So why did we decide to go down this route, I guess, is probably the question that a lot of Nimue stockists will be asking us. Already Nimue is amazing, it's very successful globally. Why did we choose to create an MD line? So I wanted to share with you a video now from Jackie where she explains to you the rationale behind the reason why we chose to go through to MD.
I'm Jackie Swart, the Head of Research and Development at Nimue Skin Technology. There's a growing need to offer products to support both invasive and non-invasive treatments, as well as plastic surgery procedures. An innovative first from the Nimue laboratories, MD is a skin rehabilitation range designed to do just that. It is a compact and integrative range of products for the rehabilitation of the skin in medical aesthetic procedures.
So as you can see there, it really is to support what we have existing with Nimue. And I guess almost going back to how Nimue was very first formulated in the fact that we want to support treatments. So our Nimue MD, you can call it a rehabilitation range in the fact that it supports your skin in many different ways to recover, you could say, from any kind of aesthetic or post-medical procedure. So basically, if there is any form of inflammation, bruising, swelling, any wounds created, these are the products that are going to help to treat them. Now, when you use the products alongside many devices, many treatments, many procedures, you are going to have a reduced outcome, or reduce patient downtime and a better outcome, because they work hand in hand with your skin's ability to heal. So it just basically speeds the process up. Now, the products are all very individual. As you can see, there's a lineup of many different products that I'm going to talk to you about this evening. Some you can use directly post-procedure, and your client can take it for home care. Some products are purely home care only, and some products work in combination with each other, and some products are standalone. And I will walk you through those. As I said, any questions, we will address those at the end of the presentation. So this is the lineup of our products. So looking great, as I'm sure you can see, they look, very sort of medical looking, very clean, very Nimue as well. It is a brand on its own, however, so it does sit very separate to Nimue in the fact that it's not going to be put in any of our education. You won't see a lot of sort of consumer type of reels or anything like that with this, because obviously it is sitting more with the medical aesthetic clinics. So you can use it alongside Nimue, but you could just have the MD on its own. So I'm going to talk you through the full 8 products. So as you can see, this was the first 4 products that we introduced to the range. And then these are the extra 4 products that we added into the range as well. So if we take a look firstly at this whole arena of medical aesthetics, because this is really varied, and I think, there's in every country, there's so many different variants accordance to regulations, but the sort of practice is fairly similar. So if we have a look here, we've got our basic beauty salons, so to speak. So your beauticians, they generally tend to do facials, nails, brows, makeup, threading, lashes, hair. Now, you may have 1 or 2 therapists that sit in this beauty type of salon that maybe wants to advance and start to offer perhaps anti-wrinkle treatments, maybe laser therapy, maybe they're starting to do a little bit of microneedling, or possibly they're doing things like dermaplaning, PRP maybe. Or they could perhaps have one day where they invite a doctor in who does all of the topicals, the fillers, the Botox, those kinds of things. So that's why you've got that one in the middle, because sometimes that does sit with the therapists. And then, of course, you've got the other side, which is the cosmetic surgery. Now, lots of Medi type of spas also has a crossover. They have the plastic surgeon who comes in a few times a week. They have the aesthetic therapists and nurses who perform all of the other treatments, like laser, anti-wrinkle treatments, fillers, and so on and so forth. So the Nimue MD sits perfectly with medical aesthetics and cosmetic surgery. And when we actually looked at producing the product, we worked alongside a well-renowned plastic surgeon in South Africa, whose name is Dr. Dion Veyers, and I'll share with you his video at the end. When we were formulating the products, this is actually his drawing, and he wanted to see how ingredients, technology, and products could support what he offered within his clinic. So basically, he said that the main or the most popular treatments is always to treat aging. So any medical intervention to decelerate the aging process is what people want. So there are many avenues, as you could see. You could go down the neuromodulation, your Botox, your hyperkinetic wrinkles. You could go volumization with your fillers and various types of fillers, as you know, that are out there. Maybe it's the repositioning with the non-invasive, or it could be threads, surgical facelift, or you could go down the collagen induction therapy, lasers, IPL, chemical peels, biomodulation, which is stem cells, PRP, other biologicals. And for all of those, the best supportative is the home care products, is what you do, the topicals, as you can see. So topicals are going to really help to give maintenance for the skin, going to help the skin health, but ultimately reduce the downtime, which is enhancing the results of whatever procedures are happening. But of course, they need to be active and they need to be of a high level as well. So that is the concept behind the ND range. If we have a look at what we might possibly see with our skins. So you can see here, it could be that there's redness, swelling. Reese, I'm on a call, please. Please, Reese.
Are you nearly done?
No. Sorry, everybody. A damaged barrier, redness, swelling. It could be itchiness. Basically, if there's any form of inflammation, wounds, bruising, this is your indication really for using the line. So further indications where you could possibly use MD, post-microneedling, microblading, chemotherapy. You can also use it with the recovery as long as they've got medical permission to be using products. They can even support radiation therapy, autoimmune disease treatment, and eczema as well. So if we have a look now at the products and the ingredients. So when we had our sort of lineup of products, we went back to basic, which is looking at, okay, the inflammatory process, the wound healing process, what exactly happens. So as you know, when you go through a wound, there's several different phases. You go through inflammation, reepithelialization, proliferation, and then eventually remodeling, you know, of collagen, skin cells, and everything. So when we looked at where the products fit in, particular products that can be used in conjunction with the treatment is our anti-inflammatory serum, our post-procedure recovery balm, and I'll mention them again when we go through them, our cooling gel and our microglide gel. So these are going to support those first stages, which is inflammation. So they're going to decrease the inflammatory state, and they are supporting the skin cells to reepithelialize, so speeding up your recovery. If we have a look at the home care products, the retail products, they are what is going to support ongoing. So again, the serum, the balm, the cooling gel, in addition, the scar gel, replenishing rescue cream, our EGF power serum, and brightening serum. They work then on the proliferation and also the remodeling phase as well. So let's get started with our anti-inflammatory serum. So small but mighty, I say. It's a 30 ml. It's a gel-based serum. It is a serum that you can use with any non-invasive or less invasive treatments where skin is stimulated. If there's any heat, any erythema, this is perfect. So it controls inflammation. It instantly soothes a very sensitized skin. It promotes recovery of the skin, restructuring of the skin. It helps to protect the barrier and it aids with hydration and suppleness. So you can see, as I said, this one can be used in a professional and home care. So you can see here, we've given you approximate usage guidelines. Obviously, it depends on your treatment. It depends on the area that you're treating. So this is just a rough guide for you. If it is post-procedure, it's going to be approximately 1 to 2 pumps, and you're going to massage just simply on the area. So let's just say you've done microneedling, you would apply it after microneedling. If you are using it as home care, say you've had an intensive laser treatment, you want to help with the erythema at home, this is going to sit with your kind of serum step. So it will go underneath a moisturizer, and then you would follow with your SPF if you were using that in the daytime. Some key ingredients that we have within our anti-inflammatory serum, kind of the major hero ingredients behind this is horse chestnut. So horse chestnut is what gives this the brown colour. And this is very good for microcirculation, excellent for inflammation. We also use in there turmeric plant stem cells to work on the brain-skin connection, so to control the redness, the itch, the pain, the discomfort. We also have vitamin B5, and we have a molecular skin repair to aid the barrier and the hydration levels. So here you can see the horse chestnut. I'm sure you're all familiar with this. Always appears in autumn, so we'll start to see them now. So this is what helps with the circulation, redness, and also strengthens the immune. Turmeric, a very popular ingredient to use with cooking. It's anti-inflammatory. It also helps with hydration and it regenerates the skin post-treatment. And here you can see how the turmeric plant stem cells that we also use with this is what works on that brain-skin connection. So it's called a neurocosmetic in the fact that it helps when there's pain, itch, discomfort that you would have post-procedure. We then have a natural alternative to hyaluronic acid, which comes from your tamarind plant that you see here, and it's called our natural polysaccharide hydrator. So ultimately, just like hyaluronic acid, this is to add hydration, help with the barrier, help to improve the skin's moisturization and elasticity. We then have an ingredient that we use in Nimue. We launched it when we launched our sensitive range, and that is your glycerinitinic acid. So as you can see from the visual, it is derived from licorice. This is the perfect ingredient to reduce any pro-inflammatory mediators. So again, when there is that level of inflammation, it suppresses those mediators. It also helps with free radical properties, reducing erythema, and it also aids with that pain and discomfort. So here are some of our in-house studies when we have used this. So this is when we have done microneedling over 12 weeks with the pen, and this is where the anti-inflammatory serum was a supportive home care product. So obviously this client's skin is quite vascular, so this obviously helped to reduce the redness and inflammation. The next product that we have comes in 2 sizes, and this is the post-procedure recovery balm. Now this texture, the post-procedure recovery balm, is quite thick. I'm not sure if you can see it quite clearly on the screen here, but it is almost like a coating for your skin. So basically, when there has been any type of damage to the skin and you almost need a protective coat, so to speak, to allow your skin to re-epithelialize, to allow your skin to heal, this is the solution. So as you can see, we've given some indications for this. This is a little bit more for more invasive treatments. So something that is going to cause if you're doing like a skin peel where there is literally no barrier left. So I'll show you in a moment a TCA, you know, quite a medium depth peel or an invasive laser, or even you can use this on burns. And we have trialed this with the burns unit in South Africa. So many of the visuals you will see is also with the burns nurse where she has used the products as well. So you can use it on cuts, abrasion, anything where the skin is open. And I always think just where there's no barrier, no protection. I've used it myself when I've burnt my hand and I know that pain and that tingling from a burn. This takes all of that away. So the ingredients in this is very minimal, which I'll talk to you about at the moment. And again, the amount that you use just varies. You can see a little goes a long way on my hand. So we say roughly 1 to 2 pumps, depending on where you're treating. If you are treating post procedure, so let's just say post laser, post, medium depth peel, then you're going to use 6 pumps if it's the full face, neck and décolleté. You would not use this after microneedling. It is occlusive. It is not a good idea to use it after microneedling. It is something that you would recommend then as a home care product. So the big size would be kept, for your professional, and then possibly you would give the smaller size maybe for your clients to use at home. It is a short-term product use only because when your skin starts to heal, you no longer need the recovery balm. So as you can see, we put it approximately for 3 to 5 days or until you feel the barrier has been restored. Reapplication is the key. So we've put repeat 3 times, but it really just depends. The more you apply, the better it is. So like I said, ingredients are quite minimal with this because of the nature of the product. The main ingredients is the complex of avocado phytosterols. We've also got an isosterol isosterate, which you'll be familiar with. And we added the seed from the cannabis sativa plant to aid with soothing and antioxidant properties. So here you can see the cannabis sativa, the seed oil. So this is the powerful antioxidant, potent anti-inflammatory, and soothes and aids the skin to heal. Avocado, that is what gives sort of the nourishment, the barrier properties with this, aiding again for hydration, and vitamin E as well, which prevents scarring. Here are some visuals, and you can see this is from a hot water burn. So very small girl here, 16 weeks. Obviously she's young, so her skin heals quite quickly. But just to give you an idea, where you can see on picture number 1 before, you know that skin is raw. That skin has no barrier. So just coating it with this lovely balm just really allows the skin to do its job, which is to heal, to re-epithelialize, for the microbiome to come back, the barrier to form, the skin cells to form. And then you can see that amazing after picture there after 16 weeks. This is another burn victim, so hot water burn again, and just look at that. So this is after just 7 days, where the client was repeatedly, again, just applying the product, just letting the skin do its job and healing it as quickly as we possibly can. Here is post TCA peel, so you can see before, so that's directly after the TCA. As you know, with TCA, your skin will shed. That's a normal process, but your skin is left very raw, very vulnerable to external aggressors. So, you need almost that coating over the top, which is what your recovery balm will do. This again is another hot water burn, and you can barely see that after 4 weeks. Reapplying that over those areas that has burnt there on the hand. Then we have our replenishing rescue cream. This is your go-to for dermatitis, for eczema. Very good for any very dry skin, flaky skin, anything where the barrier is compromised. So it could be, now winter flare-ups, it might be patches, certain areas, so it can be used on the body as well as the face. So you're going to get intense hydration and nourishment. And of course, there's no nasties in here. So it's not petroleum based, it's not steroid based. It is, going to obviously treat the inflammation and nourish the skin. It is a home care product only. And again, depending on where roughly you would apply, depends on how much. So you could apply it 3 times daily, and just a small little bit goes a long way. So you don't need an awful lot of this product. The key ingredients to this is obviously a lot of emollients, a rich lipid base. That is a combination of squalane, shea butter, provitamin B5 and allantoin. So that is aiding the barrier. We've got high molecular weight hyaluronic acid, that glycerinitinic acid, 7 natural botanicals to help with itchiness, redness, and again that's sort of pain and discomfort that you might feel. So here you've got the barrier lipid complex. So this is a mix of isosteryl isosterate, squalane, shea butter, allantoin. You've got the hyaluronic acid here, and here is our before and afters. So all of our products were trialed and tested in South Africa. And, in South Africa, they're lucky in a way because they've got so many different skins of colors. So you can see here, this is a darker skin lady. So it's not as evident as it would be on my skin, for example. But you can really see how here, this extreme dehydration has completely gone. So I'm sure she feels so much comfort from using this. Here again, you can see common place for eczema, where you will find it on joints. And again, this is after 16 weeks. So this has really helped to reduce those flare-ups. Then we have the scar gel. This has got to be my biggest wow product out of all of them. There are many scar gels out there on the market, as I'm sure you're aware of, but really these before and afters speak for themselves. So as the name says, any type of scar, cuts, burns, scars, tattoo removal, whatever it might be within the first year. When you apply the scar gel, it needs to be on a closed wound, or if you still have a dressing, it can be used over micro tape. It also helps to reduce post-inflammatory hyperpigmentation, and basically it aids the skin cells to heal, to knit back together, as quickly as possible. So this has a big or a huge array of ingredients in there. So I'm going to share with you just a select few of them today, but there is a lot more ingredients that we have in this product. So just to give you an idea, the types of scars that you could use this on could be post-acne. So as you can see on the picture here, it can also be used on keloid, hypertrophic scars, contracture scars as well. So as long as the scar is within the first year, it can also be used alongside maybe microneedling if you're also doing that to help to treat the scar. The earlier you can apply this, the better results that you get. So this is home care product only, unless obviously you're using it post microneedling and you might want to apply it directly after the treatment and then maybe send them home with the product. We do not recommend, due to the growth factors in this, that it is used on eczema, psoriasis or skin cancer. And if you are using it on top of a micro tape, you still need to replace your tape as guided, which is normally about every 4 to 5 days. So reapplication of this product is also key, and a little goes a long way, the same as the others. You just need a small amount to massage onto the scar tissue. Here you can see again for existing scars, immature scars within the first year. So if we have a look now at the ingredients. So I think my computer is catching up. So you can see horse chestnut again, so that's what gives it the darker color. We have an EGF in here, so epidermal growth factor, which comes from your plants, so oligopeptide, so it's your non-human source. We've got also in there another form of, you can say it's almost like a mimicking type of growth factor, and that is called the bioavailable peptides. We've added in there the cannabis sativa oil again, turmeric plant stem cells that we've spoke about. The niacinamide is what is helping with the post-inflammatory hyperpigmentation. And we have in there lipohydroxy acid. So lipohydroxy acid works very similar to salicylic in the fact that it helps with exfoliation and helps to kind of slough off any of those dead skin cells that have built up. We've also got in there the glycerinitinic acid, so that's aiding the pain and the discomfort you might feel with the scar. So the epidermal growth factor you can see here. So a protein complex of 53 amino acids promotes cell renewal. Like many growth factors, they help with cell differentiation, renewal, stimulating collagen, and helping against inflammatory mediators. We have got some information here just on the safety side because we know there's a lot of controversy behind using growth factors. So the fact that, you know, the growth factor that we use, the oligopeptide, is mitogenic, so it stimulates cell proliferation. It is not mutagenic, so there's no, you know, cause for concern with that. Also, the EGF is critical chemical that we cannot function without it. Extensive research that is done on growth factors now and where we're at now, particularly with plant stem cells and technology and biologics and things like that. We know that this has also been approved to use without restriction within the EU, and also Australian government has also approved the EGF in cosmetics to be used. As I mentioned, just be cautious with anything like psoriasis, eczema, or skin cancer where there's an abnormal growth of cells. The peptide that I mentioned to you that works very similar to the growth factor is from the plant Centellia asiatica that you will see here. So this supports in wound healing, helping the skin cells to reform and provides cellular protection as well. The lipohydroxy acid, as I mentioned, works very much like salicylic in the fact that it aids the exfoliation. And in there, we also have an anti-stretch complex, and that is also helping with reepithelialization and supporting the healing aspect and stimulating collagen. Additional ingredients in here, the niacinamide, the horse chestnut, glycerinitinic, and turmeric as well. We've got the seed oil, which gives you the nourishment, and that natural hyaluronic acid, which comes from your turmeric plant stem cells. So a lot of ingredients inside our scar gel. Here you can see where we have used it post-procedure. So an operation was used on this picture number 1, where it says prior to operation to close the wound. So obviously it's an infected wound there. Once the stitches were out, so once sutures are out, you can then apply your scar gel. And you can see this is 14 days after using the scar gel. The post-procedure recovery balm was used immediately, so that can be used on top of stitches. So that's what we would say exactly, you know, as soon as you've got that redness, the skin, you know, you've had an operation, the skin is starting to heal, use the balm. 3 to 5 days. Once the stitches are out, normally a week, 10 days, however they recommend, then go ahead and use your scar gel. Here you can see an older client, so this is 42 days, same thing. Balm was used first of all. As soon as the stitches were out, then you go over to using the scar gel, and you can see it's hardly visible there. These ones are my wow ones because this again is a skin of color. Darker skins tend to heal with a lot of post-inflammatory hyperpigmentation. So you can see here this particular scar, how it's really healed, quite dark actually. So this was used in conjunction with microneedling. And just look at that, 28 weeks, you can hardly see the scar at all. So I'm sure the client was extremely happy with that result. Another one, again, you can hardly see it. So microneedling to help with the depth, obviously stimulate the collagen, and then the scar gel then really helping to reduce that inflammation, heal the skin, get the scar to be reduced, and also to help with any post-inflammatory hyperpigmentation. Then we move on to the latest additions to the line. So this is our cooling gel. As the name says, it's a gel that cools the skin. It is good to be used after a procedure, clinical practice, and then you can continue to use it at home. It has been designed to be used for bruising and swelling. So it could be post-Botox, post-liposuction, anything where there is a lot of edema or you have a lot of bruising. So any sort of radiation treatment where the area has been burnt, you can also use the cooling gel. So this offers immediate and long-lasting cooling effect. The ingredients are aiding to reduce bruising, and also that helps with inflammation, and also it stimulates your microcirculation. So professionally, it depends on the area, how much you would use. So this is just an approximate for face, neck and décolleté, 2 pumps, and then you would just continue to use it regularly for home about 5 to 7 days until you see swelling has been reduced or bruising has been reduced. So the ingredients in here, again, we have the horse chestnut, which is helping with the microcirculation. We have a cooling agent, which is your methyl oxypropanediol, and aloe vera gives the slip and glide. We've got the polysaccharide in there, the hyaluronic acid, and there is also some eucalyptus. So just to bear in mind, because of the stimulation aspect, don't go too close to the eyes. So if a client has had eye surgery, you could go around the eye orbit, but not directly onto the eyelid itself. So if they've had anything here or anything here to lift the brows up, then you could use it around that area. So the cooling agent, the menthol oxypropanediol. So this is an ingredient that we use in Nimue already. It gives you an instant cooling. It provides a sensorial kind of cool sensation to immediately calm the skin. The additional ingredients, like I said, is horse chestnut, polysaccharide, aloe vera, and you've also got that eucalyptus oil. So here is our before and afters. So here you can see this is 4 days after liposuction. Obviously, support stockings would have been recommended. So this would be used alongside and here as well. So support stockings, I'm sure, would have been recommended. This is just 7 days post-procedure. So you can see how that's dramatically taken the swelling and that bruising down from the liposuction. We then have our microglide gel. So microglide gel has been a product that a lot of therapists has been asking for many years. They're wanting something to microneedle with. Of course, Nimue has superfluids, which are great, but they have not been designed to be used to needle with. They just penetrate into the skin. So this gives you the slip and glide. You can use it with any type of device, roller, pen, radio frequency with microneedling, whatever it is that you have. It has hyaluronic acid, high molecular weight and low molecular weight to really aid the skin in recovery and regeneration. Approximately 18 pumps for face, neck and décolleté, and obviously this is a professional product only. So in there, as you can see, your 2 types of hyaluronic acid and your turmeric plant stem cells. Your high molecular weight, so working more on the surface, helping with transepidermal water loss. to your lower molecular weight, which is helping then to repair the barrier, inhibit hyaluronidase, collagenase, and aiding with pro-inflammatory mediators, your cytokines. Then we move on to our power serum. So this is probably, I would say, the most expensive out of the range, because anything that has growth factors in it tends to be of a higher price. This supports any aging treatments that you do. So this is a home care product. It could be that you've got your client in for a course of laser. It might be that they also have in peels. It might be other modalities that you're doing as part of a package. This would be their home care treatment to aid all of those procedures that you're doing for them. So it is a home care product, approximately 6 pumps underneath your moisturizer, following then with your SPF. This is jam-packed, as you can imagine, full of lots of ingredients. You've got your growth factor, again, your EGF, along with a peptide, so a biomimetic peptide, along with vitamin C. So it's very rare to have a growth factor in combination with so many active ingredients. So the first thing is looking, when you're looking at different growth factors out there, is what type of growth factor is it? Also, when you're choosing a growth factor serum, it's looking at the purity. What is the combination? Is there anything that is going to be added into the formula? So we've got the purest form of growth factor. Obviously, like I said, we've got the supportive biomimetic peptide, and we have our ascorbic acid in there as well. So here you can see the EGF, aiding that cell renewal, aiding the stimulation of collagen and hyaluronic acid. And then you have your tamarind plant helping with remodeling, alongside your biomimetic peptide. So this is working on your collagen, helping to rejuvenate the skin, aiding your skin to repair. On top of that, vitamin C. As you know, vitamin C is essential for collagen synthesis. It's also a powerful antioxidant. The form of vitamin C that we use, which is ethyl ascorbic acid, also helps to inhibit any melanogenesis and evens out the skin tone. So a really powerful EGF serum. This is 17 weeks of just using the serum on its own. So we just wanted to trial the product on its own, and you can see a decrease there in the deep furrows on the forehead. And here again, you can see the deeper lines, the nasal labial, how that is also reduced. And that was using in combination with microneedling. Last but not least, we have our brightening serum. And I know you're going to absolutely love this one. This brightening serum has been developed to treat pigmentation and post-inflammatory hyperpigmentation. It can be used on its own, or it can be used post-procedure. If you're doing a laser treatment for pigmentation or a non-invasive treatment to treat pigmentation, this would be your home care product. It has been designed for the face, but it can be used on the hands, chest, back, scalp, wherever you're seeing age spots or any form of pigmentation. So home care, again, like the growth factor serum, it's 6 pumps underneath your moisturizer, followed with your SPF every day. And this ingredient complex, again, very much like the epidermal growth factor, it's a combination of all of the ingredients together that makes this so powerful. So the main ingredient in this is the smart delivery of the tranexamic acid, which is the best ingredient out there at the moment to treat pigmentation. On top of that, we've got a peptide complex, which is also working on your tyrosinase inhibition, niacinamide on your pro-inflammatory hyperpigmentation, ascorbic acid, again, helping to lighten, brighten, and inhibit melanogenesis. So tranexamic acid, I'm sure many of you will have heard of, is the latest. It is the best ingredient to formulate with. Why? Because there's very low irritation to it. It can work hydrophilic and lipophilic, so easy to formulate with, easy to absorb within the skin. It is in a smart delivery, which ensures that it penetrates into the skin. It is working on inflammation. It prevents UV activation of melanocytes. And it is also working on, like I said, that inflammatory cascade. If we compare it to other ingredients out there that have been designed to work on mainly melanogenesis, they can be called your tyrosinase inhibitors. So anything like hydroquinone, kojic acid, arbutin, ascorbic acid, azelaic acid, they typically work on that enzyme process that happens with melanogenesis. When we look at tranexamic acid, we know that this also works on the activation of the melanocyte cells. We know, like I said, the potential for irritation is a lot lower. And we also know that the stability of the product is far superior. On top of that, the peptide complex, we've also got in there, you can see the breakdown of the different peptides that we have in its own delivery system, and your vitamin C. So your ethyl ascorbic acid offers higher penetration. It's a water soluble. It works not only on, inhibiting tyrosinase, it's what we call a double block. So it also works on the inhibition of polymerization of your melanin as well. So it inhibits melanogenesis and evens out the skin tone. On top of that, like I said, your additionals are your niacinamide, nicotinamide, and your natural polysaccharides, hydrating, and your isosteryl isosterate. So a jam-packed serum for you. Here you can see some amazing before and afters. And again, we're so fortunate to work on darker skins that we can really see these amazing results. So this is just after 6 weeks. You can see a lot of post-inflammatory hyperpigmentation here on this client. And in particular, this client. I mean, look, a much darker skin of color, 6 weeks, just look at the nose, look at the cheeks. I mean, that is absolutely amazing to get those results in such a short period of time, 6 weeks only. Normally, that's like, you could say probably 5 months worth. So that's a really, short period of time. And this wasn't a professional treatment. This was just using the product on its own. Here, this was using in conjunction with microneedling. So this is 4 months. And again, you can see this as, I would say, possibly more sun hormonal type of pigmentation, judging by the look of it, and 4 months results. So that is our MD products. So I'm sure you're excited to get your hands on them. I'm going to now share with you a clip from Dr. Dion Veyers, and then I'm just going to finish off with showing you what is available for you to trial, to promote the range, and then I'm available for any questions. So I will just share the video with you.
I'm Dr. Dion Veyers, board-certified plastic and reconstructive surgeon with a private practice at Four Ways Life Hospital, Sandton, Johannesburg. In terms of medical intervention, to decelerate the aging process, there are numerous treatments and procedures. Non-surgical procedures include neuromodulation, like Botox, volumization, like fillers, repositioning, the non-invasive techniques of Thera, but also less invasive, AccuType, FaceTite, or threads. Biomodulation using PRP, PRPM, stem cells, and other biologicals, and also the resurfacing procedures using lasers, IPL, invasive or non-invasive radiofrequency, and chemical peels. And then lastly, vein treatments. Key to these medical interventions is topical products that offer the following: support or control trauma to the skin in your peels, your devices, lasers, needling, injectables, surgery, wounds, burn wounds. Secondly, improve the outcomes of the instrument-based trauma created. Thirdly, support reepithelialization. Fourth, accelerate healing. Fifth, control the inflammation. Sixth, decrease the downtime, and ultimately 7 to have enhanced results. This is the exact gap that Nimue Laboratories fills with a new compact MD range, as these integrated products have been specifically formulated to rehabilitate skin post-medical aesthetic procedures by controlling inflammation, accelerating healing, decreasing downtime, and enhancing results. First product tested in practice was the post-procedure recovery balm. Patient 1 came into my practice after suffering a facial and upper body burn wound. As the course of the treatment progressed, we could see a visible improvement in the healing process of the skin. And by day 7, the damaged tissue had been removed, peeled off, revealing undamaged skin tissue underneath. Patient 7 came in for microneedling pen treatment, which does result in inflammation and redness. Over the 12 weeks of use, it takes away the discomfort and soothes the skin. Post-operation, patient 13 used the post-procedure recovery balm and scar gel. Within 14 days, the wound had completely healed and the scar had improved drastically. The last product is the replenishing rescue cream. Patient 14 suffers from eczema flare-ups. The rich replenishing rescue cream was used over 3 months to help control her very dry and flaky skin and compromised skin barrier. It provided the skin comfort, relief, and nourishment.